Good evening, everybody. We'll start with today's session. First of all, a very important function, and that is Ashadi Ekadashi. We are celebrating over here, and it's a very important thing which is there in everyone's mind in Maharashtra specifically. At the same time, we are celebrating Bakri Eid also. Both functions. So we'll start with session. We were discussing since last 3-4 lectures regarding the potency selection and the repetition of the doses. Potency selection, Hahnemann have explained very nicely few important things over here, right from aphorism number 275. One must learn them properly so that he can understand all those things very clearly. We have learned certain things, out of which 5 points which we have learned. The first point which I have explained to you, higher the susceptibility, higher the potency, less is the repetition. Second point which I have explained to you is lower the susceptibility of the patient, lower the potency, and repetition is needed till the susceptibility gets aroused.
Sir, your voice is low, sir.
Hello. Is it okay now?
This is Dr. Utpal here from Assam, sir. Your voice is low, sir. I am joined first time.
But it is clear because it shows me here the frequency. You raise your volume because it is very clear over here. It has been not lost. Okay. So higher the susceptibility, higher is the potency, less is the repetition. Second point which we have learned is the lower the susceptibility, lower the potency, repetition till the susceptibility gets aroused. The third point that you have to select the potency depending upon where exactly do you want the result. So the site of the disease, the pathology where it is present. So that is third point which you have to take into clear consideration. The fourth point which Hahnemann have explained in last aphorism, higher the simillimum or very perfect the simillimum, higher the potency, less repetition. And fifth point which he has explained is related with what medicine you are going to prescribe. Because every medicine has its own action. Certain medicines, even in crude form, acts violently. They produces their effects in crude form. So they never require too much dilution, too much potentization. But certain medicines, which in their crude form doesn't show any properties, and when you start potentizing, then they shows their properties. In such cases, it is needed to raise up to the higher potency. So these are the 5 points which you have to take into consideration while dealing with the patient. So these are things which we have learned up till now. Let us go ahead with the aphorism number 279, what he wants to explain regarding it. So aphorism number 279. This pure experience shows universally that if the disease do not manifestly depend on a considerable deterioration of an important viscous, even though it belongs to the chronic and complicated diseases, and if during the treatment all other aligned medicinal influences are kept away from the patient, the dose of the homeopathically selected and highly potentized remedy for the beginning of the treatment of an important, especially chronic disease, can never be prepared so small that it shall not be stronger than the natural disease and shall not be able to overpower it, at least in part, and extinguish it from the selection of the principle of life, and thus make a beginning of a cure. So now he is explaining what one should do when you deal with the chronic diseases. In acutes, we have discussed. Acutes, we get generally a very clear-cut symptomatology, and that's why second important thing, we get higher susceptibility. So higher the potency, that's very important. But less repetition is needed. But generally, when the pathology is marked, when the disease is absolutely affecting any specific organ, it is chronic one, and patient comes to you, there are many chances that you never get a very perfect simillimum many times in the first prescription. But still, if you get a very perfect simillimum, you should start the treatment with considering the susceptibility of the patient. Generally, those patients who are suffering chronically generally have a low or medium susceptibility. They don't have acute susceptibility like an acute disease. And in such types of cases, you have to start with the medicine in a potentized form, but that potency should not be too high as you select in acutes. It should be just more than that what is needed, judging the susceptibility of the patient. And then you start it gradually and gradually go on ascending. Here he wants to explain that here the better potency is the LM scale, where you can go on ascending the potency. Specifically, the disease is chronic, you can go on ascending the potency even though the remedy is defective. If you consider the calcarea carb, if you consider the lycopodium, if you consider the silica, if you consider the lachesis, the lycopodium, all those medicines which are deep acting enough. In centesimals, we get restricted to repeat because centesimals are very strong potency. Generally, they affect directly, and if you are treating the pathology and if you are using the centesimal, then you have a restriction to repeat. Even though you have selected 30th potency, you have to be restricted to wait for 15 days, 20 days, 1 month before repeating it. But if you use a mild potency, comparatively the 50 millisimal or LM scale potency, and you go on ascending, you repeat it many times by giving more succussions every time, liberating the energy from that. And in such types of cases, when you go on ascending at a certain level, you will reach specifically at a certain point where you start getting the old symptoms of the patient again. This is what he explains in the next aphorism. That in chronic, how to understand whether your remedy is acting or not acting. Specifically, it is a miasmatic disease, either psoric or psychotic or syphilitic, where there is suppression either in the past or family history of the patient. Then you have to understand that if the reverse starts, if the original symptoms of the disease starts appearing, then it is the time where the patient starts showing, where you understand your remedy is perfect and it is going in right direction. So here there is a need to utilize potency just more than that patient susceptibility. Better potency is always a LM scale. But if you give the centesimal, then you start with low and gradually ascends like a plussing technique, which already we have discussed while discussing the aphorism number 260, 263 around, where he has explained about the plussing technique. So if the chronic disease is there, generally the susceptibility is low, your potency, you should not go too high. It's just above the patient's susceptibility, and gradually you have to go on ascending. That he explains in the 280. So we'll learn the 280 also today. The dose of the medicine that continues serviceable without producing new troublesome symptoms is to be continued while gradually ascending. He has written it in italics. While gradually ascending, you have to go on gradually ascending, not immediately. So day one you have given LM1, day two LM2. No, first you have to give the LM1 for a certain period with increasing energy only by giving the strokes, by giving the succussion. and then you have to change the potency. The gradually word has meaning. Generally, what happens, we never understand sentences and words. He has mentioned it very clearly. He is very thorough about it. So what he says, the dose of the medicine that continues serviceable without producing new troublesome symptom is to be continued. So till you are giving the same dose and it is not causing any harm to the patient, let it continue. So in LM, you can repeat it many times. Why? Without producing any new troublesome symptoms is to be continued while gradually ascending, so long as the patient with general improvement. Till the patient goes on improving, continue with it. Till the patient is showing the positive signs, continue with it. There is no need to immediately shifting from 30, 200, 1M. No, no. If you go in such a way, in such a manner, you're going to suffer. You'll create the problems for you. So when you treat the chronics, the thought should be very clear in your mind. And all things are mentioned in this organon. Only thing is that we keep this book outside. We never read the organon properly. So long as the patient with general improvement begins to feel in a mild degree the return of one or several old original complaints. Till the patient starts showing the original features. For example, if you are treating something like epilepsy, you have taken the detailed history of the case, and you find it out that 6 months back that fellow was suffering from some fungal infections in the groin and applied the ointments, certain steroid antifungal ointment, and disease has been suppressed, and later within a month or two he developed epilepsy. Now the patient is there for epilepsy to you. When you start giving him a medicine, whatever it may be, might be ginkgo met, might be cuprum met, varies, and you have started giving it till the medicine is acting, let it continue. Find it out whether the epileptic attacks have been decreased or whether they are stopped, and let it continue till the original symptom starts appearing. If the patient is young enough, you can get it very early and you can use centesimal also. But if patient is old enough, then you have to go gradually because susceptibility is low in old people. So you have to think with many factors. So if you would have started with ginkgo met LM5 and you have started repeating it, gradually you have ascended it LM6 and patient is not having conversion, but patient has not yet reached to the primary symptoms. You have prescribed the remedy. After coming to LM10, he started showing the skin symptoms. This is the time where we are understanding now the cure has been getting completed. Now the homeopathic aggravation is starting. Now the original symptoms of the disease started appearing. This is too important to understand, which he has mentioned over there. So what he says over there, so long as the patient with general improvement begins to feel in a mild degree the return of the one or several old original complaints. This indicates an approaching cure through a gradual ascending of the moderate doses, modified each time by succussion. That is Aphorism 247. So what he is saying? Whenever you have prescribed by plussing technique and gradually you are increasing it again and again. So you have started with 30, 31, 32, 33, 34. And at a certain level, you started getting those symptoms. So this indicates an approaching cure through a gradually ascending, the moderate dose is modified each time by succussion. It indicates that the vital principle no longer needs to be affected by the similar medicinal disease in order to lose the sensation of natural disease. So now what has happened? Now medicinal disease is getting hold of the case. And now vital force started reacting. Now it started reacting, showing the original symptoms of the disease. Now the present disease is completely vanished. Now it has started showing the original primary manifestations of the disease. And if they started appearing, now it is the time to stop. This is very important indication. Now it is the time to stop. Wait for a week. Wait for 15 days. So what he says? It indicates that the life principle now free from the natural disease begins to suffer only something of the medicinal disease, iterative, known as homeopathic aggravation. So now it is the time where the homeopathic aggravation has occurred. This is the difference between acute disease and chronic disease. In acute disease, homeopathic aggravation happens within after giving the first dose only. Within first few minutes, you start getting the homeopathic aggravation. Things are rather different. When you are treating the chronic disease with the help of such LM scale or plussing technique, gradually when cure has to happen and when primary symptoms starts appearing, that is the time, that is the homeopathic aggravation you will going to get hold. So this is the one important difference one has to understand regarding the homeopathic aggravation. Homeopathic aggravation is always possible in acute disease immediately, whereas in chronic disease, it takes a long time till the recovery starts appearing. So this is one important thing, keep it in your mind, and then what to do. Once you have reached to this level, then what to do? How to go ahead? That he mentions in the next aphorism. We'll finish that aphorism and we'll stop because here he mentions exactly what exactly one should do if such thing started appearing. That is aphorism number 281. In order to be convinced of this, so if you want to confirm whether it is really homeopathic aggravation or something else, the patient is left without any medicine for 8, 10 to 15 days. So now you stop your giving medicine. Ask the patient not to take any medicine. Meanwhile, giving him only some powders of sugar of milk. So just give the placebo and see what happens. If the few last complaints are due to the medicinal simulating the former original disease, then these complaints will disappear in a few days or hours. So if it is because of medicine which is getting more than the natural disease, means homeopathic cure has to happen, then if you stop giving medicine, all symptoms will vanish itself. Then these complaints will disappear in few days or hours. If during these days, without medicine, while continuing good hygienic regulations, nothing more of the original disease is seen, he is probably cured. So if during this period, patient has never develops anything, he is completely free of symptoms, it might be patient is probably cured. But if in the latter days, traces of the former morbid symptoms should show themselves, they are the remnants of the old disease not wholly extinguished, which must be treated with renewed higher potency of the remedy as directed before. But if you find it out within those 8, 10, 15 days, that if still the symptoms are persisting, they are not disappearing, then it is the time that indicates that you have to go and ascend the potency. Then it is the time that if you are giving LM8, you go for LM9. If you are giving LM9, you go for LM10 because disease is not yet completely extinguished. So all the pros and cons he tries to explain over there. He tries to explain exactly the how to go ahead. Every point he is explaining over there. So what he says, but if in the latter days traces of the former morbid symptoms should show themselves, they are remnants of the original disease not wholly extinguished, which must be treated with renewed higher potencies of the remedy as directed before. If the cure is to follow, the first small dose must likewise be again gradually raised higher, but less and more slowly in patients where considerable irritability is evident in those of less susceptibility, where the advance to higher doses may be more rapid. So if you it depends upon susceptibility of the patient. If certain patients, the susceptibility is very high, you don't repeat it too much. You have to gradually go on increasing because they might show a severe aggravation because of it. So it depends upon one more thing that you have to judge the susceptibility of the patient and accordingly you have to select the potency. These certain patients who are hyper susceptible, there are patients whose impressionability is nothing but the susceptibility. There are the patients whose impressionability compared to that of unsusceptible ones is like the ratio as 1000 to 1. So there are more susceptible patients than the unsusceptible ones. And that ratio he has explained that 1000 to 1. So be aware that you should not go frequently changing the potency and going higher. You should be gradual in approach, specifically when you are dealing with the chronics. In acutes, there is no question of repeating the medicine. Repetition of the medicine is needed specifically when you are dealing with the chronic. And here he explains that the process should be gradual one so that patient should not land into a severe homeopathic aggravation. So see, we have learned three important aphorisms. Aphorism number 279, where we have started over there, that how to start the treatment in chronic diseases or pathological diseases, and you should not be you start with too high potency. Then second, in the aphorism number 280, he explained that you go on gradually ascending the potency and do not repeat it so frequently till the potency is acting. Let it continue with that and then gradually ascend. And once you start getting the original symptoms of the disease, it is the time to stop, wait for 8 days, 10 days, 15 days, see what happens. If the patient is completely free of the symptoms, the patient is probably cured. But if the few original symptoms of the disease still persist, it is the time to renew the potency, go for higher potency. And last point which he has mentioned, that you have to take into consideration the susceptibility of the patient. There are many susceptible patients as compared to unsusceptible. The ratio is 1000 to 1, and that's why you should be quite careful while going ahead with the potencies. It should be a gradual process so that patient will not suffer because of your medicine. So three aphorisms we have finished in today's session, and all those are very important while dealing with the pathologies and pathological disorders. We'll continue with it tomorrow again, and we'll go ahead with next two or three aphorisms in tomorrow's session. That's all for today. Thank you being there. If any queries are there, we'll have a discussion. Otherwise, we'll conclude. Any questions?
Today at 9 o'clock there is a medicine.
No.
Class.
There is no session.
Okay, okay, sir.
Okay. Yes, Dr. Deepa, she has asked regarding the sharing the cases. Next session, I will share the case. In fact, I will share just a recent example. I had a case of psoriasis which I'm treating since last 1 year. I have started him with sulfur only LM1, and now he has reached the LM21 or 22. And now he started getting the original features, the vesicular eruptions basically. Vesicular eruptions are primarily psoriatic eruptions. And if these eruptions starts appearing, then it is the time that primary symptoms are coming. So what I have done, I have stopped the medicine since last 8 days. I asked him to stop, take a break for at least 8 to 10 days or 15 days. And I have to judge whether our remedy has acted perfectly, whether cure has happened, or whether original symptoms are coming. So these things which we have to apply, practically confirm what is taught in the Organon, whether you are observing same thing. And I used to do this many times. When I observe, yes, now your potency is doing very well. Now it is time to keep your hands off. And this happens many times. So whatever written by Hahnemann is very, very clear and very perfect. Yes, any
Sir,
other?
sir, Dr. Utpal here, sir.
Hmm.
From Assam, sir, what is the prognosis regarding, sir, muscular dystrophy?
Regarding muscular dystrophy, it is a genetically disorder, specifically
Yes, yes, sir.
Duchenne muscular dystrophy. It is X-linked disorder. So I'm working on it since 2008. There are hopeful results, but I cannot claim that I have cured a case, because unless and until the child is of 20 years, 25 years, you cannot claim, yes, you have cured the case. But there are many hopeful results are there. We have to work, we have to find it out how it works, because there is no answer in modern science for such types of dystrophies. I have 115 cases of Duchenne muscular dystrophy, and quite good. Those who have started very early in my practice, very early in their age, they are doing very well. Those who have already advanced, no, not having a proper result. But still, the patients, they are continuing with the medicines and hoping for something what happens about them. Okay.
Thank you, sir. But my patient is around 15 years age.
Yes.
And I've started with constitutional remedy.
Mm. You
Just
can
from
continue with
last.
these are the patients who require treatment for years together. You should gradually, in such types of cases, it is always better to utilize LM, because you have to continue with medicine for long term.
Yes, sir. Thank you, sir.
Dr. Deepa, she has asked, treatment started since how many days? Since last 1 year. So we'll conclude today's session. We'll meet tomorrow at the same time with the new session. Thanks a lot. Tomorrow we'll discuss file that question.